Hi, I'm Deacon Jerry Jawanowski, and I'm the Executive Director for Vitality Catholic Healthcare Services of the Diocese of Camden. I'm recording this message today from my home office, an office that I, like so many of us, are becoming so used to spending more and more time in each day as a result of the fact that many offices throughout the area are closed, and many of us have been asked to do our work from home. And I think this has been a great way for us to certainly help stop the spread of the virus in closed and tight environments, but also gives us opportunities to actually engage in new ways of doing things, as well as to be able to, I hope for many, connect more with family during these times and being able to see the fact that our family lives can certainly intertwine always within our work lives. So I hope that these restrictions on all of you for work at home and in being in isolation and quarantine within your homes has not proven to be too burdensome, but has been able to be seen as something that is enlightening in some ways to be able to bring us new insights into our lives. But my main message here today is to let you know that Vitality Catholic Healthcare Services continues to do its work throughout the diocese. We are fully engaged in all of our ministries, and our people are doing their work extraordinarily under new methods and new circumstances. I just want to highlight some of those for you in this brief video so that you're aware of what we are still doing. Many of you are aware of our care coordination program. This is our hallmark program that has been able to be providing help for many of our seniors and persons with disabilities throughout the diocese who are in need of advocacy and information and assistance, particularly when it comes to their health care issues related to the health care they need to receive, whether it's at home or whether it's in an extended care facility. But it's very important that our people stay connected with all those clients who need help. So our helpline is open and available. You may recall that phone number is 888-26-VITALITY, VITAL, or digitally that is 888-268-4825. You can call that number anytime, and we will certainly have someone answer that call, or if not, there'll be a voicemail that they'll get back to you as soon as possible. And one of our care coordinators, our nurses or social workers, will be in touch to be able to discuss with you your specific concern or circumstance where we can provide help. We're doing things under new ways and new methods. We're doing a lot of phone calls, obviously, some video chats, a lot of emails and text messages, and also for important documents that may need to be filled out for the payment of government programs and applications, etc. We're doing what we refer to as our front door or porch pickup and drop-offs so that we can have contactless delivery of those services. We all hope that people are still available to use our services and finding them that we can be a help to them in so many ways throughout this crisis. So whether your concerns are related to the virus or their concerns related to any other healthcare condition and circumstance you have, please feel free to call that number. We're still available during these days to help you through. We also want to let you know that our chaplains in our hospitals, our priest chaplains, are doing remarkable work under the current circumstances. As you know, there have been many restrictions placed on the visitation policies within hospitals and nursing homes, and our chaplains are responding to that. Obviously, they cannot minister directly to patients with COVID in the hospitals, but they have been able to, through video chats, through prayer on the phone, and through other methods, being able to communicate with them. It's been a real blessing for some patients to know that that priest and chaplain is there for them. They've also been able to spend a lot of time praying with the families and the staff who are going through so much difficulty during these pressing times. So again, our chaplains, our priests, and our deacons and the lay chaplains are doing a wonderful job in terms of staying connected to our patients in our hospitals. And I do ask you to please pray for them and for the work that they're doing, that it continue to be a success. We also continue work in our deaf ministry. And in our deaf ministry, we are making sure that all of our deaf people throughout South Jersey who are part of our ministry stay connected to live stream masses that have American Sign Language. We don't want anyone left out, so we have to make sure that everyone is being informed, and they can go to our website to get an update listing of where those masses are being held in terms of the location on their live streams and how they can be sure to access them at any time they need them. Many of our parish-based programs obviously are undergoing a lot of change these days. For example, our senior ministries have been closed because we can't bring our seniors together in congregate populations at any point. So they have not been able to meet. However, they've been doing very creative things to stay connected, and we see the technology of Zoom, for example, being used by some of our senior groups to stay connected. I'm just so amazed and impressed at how our seniors have adopted the technologies of today to be able to stay connected. It really shows their strong need and commitment to be connected and to stay well in touch with each other during this crisis. And our staff is staying in close touch with all the directors of not just our senior day programs at our parishes, but also with all the senior group leaders throughout the diocese so that they can share in some of the practices that are going on to help people stay connected and feel part of the church during these times when our churches are basically closed for public worship, but are able to stay connected through other means. The same thing applies to our Stephen ministers. We have many Stephen ministers throughout the diocese who continue to provide care for their care receivers. It doesn't stop during this pandemic. In fact, the need for care oftentimes is accelerated during times like this. But our Stephen ministers have been doing a great job staying connected, again, using telephones, using video chat, text messages whenever possible, but really staying connected with their care receivers in any way they can to provide that listening ear for them during these times of loss and crisis in their lives. So again, we're very proud and happy of our Stephen ministers. We've also been able to conduct some online training for more Stephen ministers to join the ranks of the many we have now throughout the diocese. So we again appreciate them doing their work to stay connected during these times. The same thing applies with our parish nurses. Our parish nurses have not been able to engage in any group activities throughout the diocese or in their parishes, but they have remained a great resource to our pastors and to our priests to be able to provide some necessary information, health assistance whenever possible. And I'm sure that they will play a big role as we bring our communities back together into public worship real soon. So I just wanted you to know that all these services continue to go on. We're very happy that we can still provide them for the people of South Jersey and know that the diocese remains committed to all the healthcare needs and concerns and to be an advocate for all those, particularly the elderly and the disabled, who are in need of any kind of healthcare service or information. We're here to serve you. We're here to help you. And may God bless you, and may this pandemic end soon so that we can all be back together and worshiping together as a full faith community. So again, God bless you. Thank you for listening to this video. And again, if you need any assistance from Vitality, please don't hesitate to call our helpline, 888-268-4825. And we'll be very happy to help you in any way possible. So God bless you.